feet apart. I know. Can't crowd behind a podium if you're going to be 6 feet apart.
Good afternoon. Thank you for joining us this afternoon. My name is Rob Cowie. I'm the Communications Director at the Oregon Health Authority. Today, we're here to announce new measures that state government and healthcare providers are taking to slow the spread of COVID-19 in Oregon, and actions state officials and healthcare leaders are taking to prepare Oregon's healthcare system to meet the coming demand. Today, you'll hear from Governor Kate Brown, Dr. Dana Harganani, Chief Medical Officer at the Oregon Health Authority, and Dr. Renee Edwards, Chief Medical Officer at OHSU. After the remarks, you'll have an opportunity to ask questions. I do want to remind everyone that in addition to other reporters and your colleagues in the media that are tuning into the live stream, we have hundreds of Oregonians who are also watching. So I'm going to ask you to identify yourself, your outlet, direct a question to one of our speakers, and then we will do our best to repeat the question so that people who are tuning in at home have an opportunity to hear the question before it's answered. So with that, I'm going to turn it over to Governor Kate Brown.
Good afternoon. Thank you all for being here today. In a global pandemic, days are like weeks, and every single hour changes. The actions we take today will save lives. Over the past week, we have taken action to help flatten the curve of coronavirus transmission in Oregon. That means decreasing the rate of infection while bringing state and federal resources up to the same speed as the spread of the virus. In order to protect the health and safety of Oregon families, my overall goals are as follows: to decrease the transmission rate in Oregon, to preserve our hospital capacity for those who need it the most, to mitigate the real-world and economic impacts of this global health crisis on Oregonians, particularly our most vulnerable families. Every step we are taking to achieve these goals is being made with community input and careful consideration of their impacts. Each action has a ripple effect across our state, both on a personal level and an economic one. But working together, we can overcome these hurdles in an Oregon way. What may work for one state may not work here, and vice versa. I've been weighing the economic impacts of mandating the closure of places where Oregonians gather. I will be issuing an executive order on new social distancing measures for Oregon, effective March 17th, for at least 4 weeks. The order will include the following: a statewide cancellation of all events and gatherings larger than 25 people, with essential locations like workplaces, grocery stores, pharmacies, and retail stores exempted. Although I urge Oregonians to avoid any gatherings of 10 people or more. Number 2, restaurant, bars, and other establishments that offer food or beverages for sale are restricted to carry out and delivery only, with no on-site consumption. Food service at hospitals, workplaces, and other essential facilities will continue. I am also urging all other businesses to evaluate your practices to accommodate social distancing measures. Basically, can your business do the equivalent of restaurant takeout? If you cannot do that, I strongly urge you to close your doors to customers temporarily. As with my previous orders on social distancing, any establishments not complying with these measures will be subject to a Class C misdemeanor, as established in Oregon State of Emergency statutes. However, I ask you to comply with the spirit of the law so that our law enforcement officers can focus on more pressing needs of our communities during this emergency. Today, I'm convening a coronavirus economic advisory council to mitigate the impacts of this action and any others that may adversely affect our economy. We are looking at a variety of tools that we have, including requests to the Oregon legislature and, of course, the federal government. We will have a report on this work in the coming days. At the request of the Attorney General, I am also declaring an abnormal market disruption regarding essential items like hand sanitizer and toilet paper to prevent price gouging during this public health crisis. I've also assembled 2 command groups, one to manage the healthcare system's resources and the other to manage our state resources. First, I'm activating a COVID-19 healthcare system response joint task force. It's building off of an effort by the metro area hospitals, the Oregon Health Authority, and local public health officials who've been meeting in an effort to address capacity issues. I am pleased to announce today that metro hospitals will act as one large unified hospital system for the treatment of COVID-19. There will be a centralized, coordinated center for managing hospital bed inventory. We will expand bed capacity by adding beds in non-hospital settings. We are treating personal protective equipment as a community resource to be reserved for healthcare workers and those who need it the most. Likewise, testing resources will be aligned, including a standardized screening protocol. It can be a model for how the crisis care plan will be implemented statewide. Dana Harganani from the Oregon Health Authority will talk more about this agreement. Second, we have activated the state's Unified Command Emergency Response organizational structure. This is an incident management structure similar to what we would activate during a major Cascadia earthquake. This will fully integrate the Oregon Health Authority's public response efforts with the Office of Emergency Management efforts to minimize any disruption to critical services in Oregon. I'm going to have Andrew Phelps, Director of the Office of Emergency Management, summarize this emergency coordination function further. I know Oregonians are some of the most resourceful people in the country. And in times of crisis, we come together and support each other. I'm asking you to do that now. Isolation from our friends and neighbors is the only way to flatten the curve of transmission and get Oregon through to the other side. Closing schools and the places we gather these are incredibly difficult decisions for me, because we all know that as a community, we hold each other in times of need. Working together, we are stronger together, even if it's in ways we never thought possible. Thank you.
Good afternoon. I'm Dr. Dana Harganani. I'm the Chief Medical Officer for the Oregon Health Authority. I appreciate the chance to stand here today with Governor Brown, the medical directors of Oregon's largest hospital systems, and state and local leaders who are supporting this response. I am here to tell you the steps we are all taking together to prioritize and deliver vital medical services to Oregonians during this pandemic. I want to echo Governor Brown. We are all in this together. I want to thank her for the decisive social distancing measures she is taking in close collaboration and consultation with local elected officials, school superintendents, university administrators, and business leaders. I know these are sweeping measures, and they will create hardship and disruption for Oregon's families, communities, and businesses. The fabrics of our lives have been fundamentally changed. This will not be easy for anyone. I know many Oregonians are worried about whether they or a loved one will get sick from the virus, and they are deeply fearful about the fallout from these measures. I want to let every Oregonian know these measures are necessary, urgent, and justified. They will help hospitals and healthcare providers prioritize hospital beds and services for people who need them the most. They will save lives. Here's what we know. We have entered into a stark new phase of this pandemic. Over the weekend, the first Oregonian lost his life to the virus. Each day, COVID-19 appears in more counties and more communities. If we do not act right now, approximately 75,000 Oregonians could contract COVID-19 by May. Without intervention, those numbers would rapidly continue to expand. No one is immune. There's no vaccine available to stop this virus, and there's no treatment. Oregon's public health experts and hospital administrators have planned for a pandemic, but those plans depend on hospitals having enough hospital beds and life-saving equipment like ventilators to manage this crisis. If Oregon's health system is swamped by a sudden spike in cases, we will not be able to save everyone. But there's hope. Oregon's healthcare providers and public health officials have prepared for a pandemic. We have a plan, and we're putting that plan into action. Oregon's crisis care guidance was created by health system partners across the state more than a decade ago to prepare Oregon's healthcare system to avert exactly the kind of potential catastrophe we are facing with COVID-19. The plan provides Oregon healthcare system a blueprint to do the following: to manage a surge in demand for medical care and quickly and dramatically expand capacity to treat more patients, to maintain critical functions, to locate and secure alternate sites to deliver medical care, and navigate the difficult, heartbreaking ethical dilemmas clinicians may face when allocating safe interventions in the face of an escalating set of patient needs. I've been working to implement these plans in the Tri-County area with OHA State Health Officer Dr. Dean Seidlinger, Tri-County Health Officer Dr. Jen Vines, and the Chief Medical Officers from Kaiser, Legacy, Providence, and OHSU. Excuse me. The framework we've developed with the regional health systems establishes a model for how we will implement Oregon's crisis guidance statewide. Not only do these health systems serve the most densely populated area of our state, many operate facilities across Oregon communities. This regional plan addresses the full range of critical decisions state and local health officials and our hospital colleagues need to prepare to make. How hospitals will expand hospital beds and staffing on a large scale. How hospitals will align priorities for COVID-19 testing, which remains in short supply due to federal bottlenecks and international supply restrictions. How to protect healthcare workers and apply a unified staffing strategy to address healthcare workers who may have been exposed to COVID-19. And how the healthcare system will serve vulnerable populations such as the homeless. The regional plan includes a list of needed actions from state government. They include releasing state stockpiles of necessary supplies of personal protective equipment for healthcare workers and securing additional equipment from the federal government and other resources. These supplies are critically low across the country. Expediting the procurement of testing supplies from the federal government, relieving regulatory requirements such as empowering healthcare workers to safely operate outside their standard scope of practice so they can see more patients, especially outside hospital settings, and finding locations to set up alternate care facilities, and finally securing needing funding to support these extraordinary efforts. The Oregon Health Authority stands ready to aid on all of these topics. Under Governor Brown's direction, we have convened a COVID-19 healthcare system response joint task force. The task force mission is to guide health systems around the state to implement Oregon's crisis care guidance. They will work with hospitals in every part of the state to make sure they are ready and to reduce the number of fatalities from COVID-19. Finally, I want to address much of the ongoing confusion about COVID-19 testing. We know many people are anxious to be tested for COVID-19. The reality is that Oregon State Public Health Laboratory has received limited testing supplies from the federal government. We have had to prioritize these limited testing resources for the sickest people and the people who are most at risk. We know Oregonians would not want to squander this vital resource indiscriminately. We are doing all that we can to open the testing pipeline. The hospital partners standing here today with us are committed to conducting testing. Outpatient clinicians are ordering tests from commercial laboratories, and those largest commercial laboratories are reporting the results to the Oregon Health Authority. We include their finding on our daily reports to the public. However, it's important for Oregonians to understand testing supplies remain limited due to federal decisions and supply chain constraints. We simply don't have all the testing capability we would want. While we've authorized outpatient clinicians to use their discretion, we know they cannot order a test for everyone who wants one. They will continue to exercise their clinical judgment as commercial labs work hard to ramp up their capacity. In the meantime, public health officials and our hospital partners will continue to focus our limited testing resources judiciously over the coming weeks where they are most desperately needed. We will continue to keep Oregonians informed about our efforts to expand COVID-19 testing across the state. I'd now like to turn to Dr. Renee Edwards from OHSU to tell you more about the regional plan.
Thank you, Dr. Harganati. Good afternoon, everyone. My name is Dr. Renee Edwards, and I'm privileged to serve as the Chief Medical Officer for OHSU Health. This is an unprecedented moment that requires unprecedented leadership and coordination. I can assure the public that the metro area hospitals, Legacy, Providence, Kaiser, OHSU Health, which includes Tuolumne Medical Center and Adventist Health, are all united in our operations and our commitment to serving the hospital needs of Oregonians. This is not just a Portland-based solution. The coordination of the metro area hospitals will also be helpful to the other hospitals across the state because we are all in this together. There are no easy choices, which is why we must take comprehensive steps to safeguard our citizens and address the potential significant strain on our healthcare system here in Oregon. I want to thank the OHA's data scientists and Dr. Peter Graven at OHSU for working together to provide an evolving forecast for what hospitals should be planning for moving forward. They have modeled the hospital bed and ICU needs for the Portland metro area through April 11th. Now, their model only goes through April 11th because the forecasted need from that date is dependent upon what we do now, leading up to mid-April. I want to emphasize that this is a situation that's changing every day. It's a model. But we have an obligation to work together to prepare for the worst-case scenario and be ready to treat those who need our care. The current modeling assumes that the number of cases in Oregon will double every 6.2 days, and that 1 in 5 Oregonians, or 20%, who become infected with COVID-19 will subsequently require hospitalization. And we know this based upon how the spread of the virus has occurred in other cities. Now, of course, the good news about this is that 80% of infected people will not require hospitalization, and they will recover at home just fine. But this modeling does tell us that without a significant slowing of COVID-19, Oregon will not be able to serve the hospital needs of Oregonians without creating more hospital beds. OHSU Health alone may need 80 ICU beds for our expected number of COVID-19 patients by mid-April. This happens to be near our current ICU capacity, and on a normal day, our ICU is already full of Oregonians who need critical care, even without the COVID crisis. So this means that at OHSU, we would need to double our available ICU beds within just a few weeks based upon this COVID forecast. So if the current trends continue, the state of Oregon may need an additional 1,000 hospital beds and 400 ICU beds to accommodate the volume of patients by April 11th, based upon our forecast. So this is why we're taking significant operational steps to make room in all of our hospitals and to operate as one health system for the Portland metro area and the state of Oregon. To prepare, the Portland Metro Health Systems are launching an unprecedented coordinated approach to make sure that Oregonians who need hospital-based medical care can have it. We will need to work together as one health system to manage this crisis. We're working hard to prepare for this surge, but we absolutely need your help. Make no mistake, social distancing works. As everyone has mentioned, this is hard. It is not what we typically do. But the virus is here, and the goal is to slow the spread so that fewer people need hospital care all at the same time as part of a surge. You may have heard the term that we need to flatten the curve. To put a finer point on this, every Oregonian, and especially healthy Oregonians, can take actions that will literally save others' lives. Please know that remaining home as much as possible, limiting your social interactions, and keeping a distance of 6 feet away from one another, combined with strong hand hygiene, will help stem the tide. And this is not just guidance for our elderly and immunocompromised. We need all of our population and our young people and families to all adhere to this. In fact, data that's emerging from other countries is telling us that the actions of young people, many of whom are healthy but who harbor the virus with minimal symptoms, they may not even be aware, can make a big difference in how fast this virus spreads. We all need to do our part to prevent transmission of COVID-19 in our communities. This is definitely a situation where we are all in this together. We at OHSU greatly appreciate the unprecedented collaboration of our healthcare colleagues, the governor's office, and the public health community at this time, and the solidarity and actions by Oregonians that we are taking and will take to slow the spread of COVID-19 and guard against overwhelming Oregon's health system and our healthcare workers. Thank you.
So now we welcome your questions. Again, remind you to please identify yourself, your outlet, and if you could direct your question to one of our speakers. And also, I would also like the speakers to repeat the question for our audience. Do we have?
We're going to get Mr. Phelps up.
What additional speaker? Okay, my apologies. I want to introduce Andrew Phelps, the Director of the Office of Emergency Management.
Good afternoon. My name is Andrew Phelps. I'm the Director of the Oregon Office of Emergency Management. I'd like to speak briefly about the structure that we're using to organize this incident. This is our all-hazard incident management and incident command structure. It's the same structure we use to manage wildfires across this state. It's the same structure we used to manage the Umatilla flooding just weeks ago in eastern Oregon. And it's the same structure that we planned for to use during a Cascadia subduction zone earthquake, as the governor referenced. This is the structure that firefighters, law enforcement officers, EMS and hospital public health workers, as well as the emergency managers across the state have trained in, have exercised for decades. This system ensures connectivity between the state's Emergency Coordination Center and the Oregon Health Authority's Agency Operations Center, where critical decisions for public health and safety are being made. This system is designed to do really three things for us. It's to coordinate our response and the response of the federal government, to coordinate state-level agency response and resources, and to ensure we're providing support to our local and tribal partners across the state. 36 counties and multiple tribes in Oregon have activated their emergency operations centers. As several of the speakers have said already this morning, we're all in this together, and we know that we need to provide the support across all levels of government and leverage every resource we have available. That's what this system does. We've also established a state command group that's comprised of the governor's office, the Oregon Health Authority, and the Oregon Office of Emergency Management. This gives us the ability to leverage every state agency as part of this response structure. As we know this response will stretch into weeks and quite likely months, we know we're going to need every resource that the state has to continue to manage this response and begin the steps towards recovery. We have some overarching objectives and priorities to drive our decisions as a state command group. Priority number one is to keep Oregonians safe. We also want to ensure the capacity of Oregon's healthcare system. It's important that we're providing timely and accurate information to all Oregonians to allow them, you, to make good decisions to protect yourselves and your families. We want to make sure that we're able to sustain Oregon's business and make sure we maintain a healthy economy through this difficult, unprecedented time. We also want to strive to minimize disruptions to critical state services and to support our cities, counties, and tribes as they're really the frontline responders to this particular emergency. I want to emphasize again, this is not a new system. This is the system that we train for every day. It's an expanded system. This incident has stretched from a public health crisis to an all hazards crisis. And again, this system allows us to utilize every tool in our toolbox to meet the needs of Oregonians and adequately respond to this crisis. Thank you.
Governor
Okay, I'll take.
KGW. I wondered, what do you think of going one step farther? Some have called for a travel ban, not letting anybody into Oregon from Idaho or California or even through the airports. Is that too dire?
Based on the information that I have from public health experts and medical professionals, those actions are not necessary at this time. But let me emphasize, at this time. Honestly, all options are on the table in the future to protect the health and lives of Oregonians.
Governor Brown, Lachey Wesley with K2 News. What is the state going to do for people who have lost their job because of this outbreak?
So I set up my Economic Recovery Council. They'll be meeting first tomorrow. We built this on the work we did after other emergencies in Oregon. For example, the Eagle Creek fire, the horrific shooting at Umpqua Community College, building on local expertise, working with state legislators. We hope to put together a package that will provide our small businesses and our employees across the state with the tools to survive over the next several weeks.
Do you have a timeline?
No. The council's stepping up tomorrow. They will report back in a few days. We'll continue to keep you updated.
And what about workers who aren't working because they're taking care of their children?
We're looking at all tools available, unemployment insurance, workers' comp. Obviously, we will be asking the federal government for all tools available to them and to us. And we're trying to be very creative and innovative. We want to make sure that Oregon families have the resources they need to pay their rent or their mortgage, and that they can buy basic essentials, food, medicine, and toilet paper.
Governor Brown, Dirk Van Hart with OPD. Given all the things you're working on, are you anticipating calling the legislature back at this point? Is that a foregone conclusion?
Look, I anticipate that there will be a special session sometime in the next few weeks. She asked about tools that we may need. One of them may be statutory changes to make sure that we have the flexibility we need to provide Oregonians public assistance, other types of benefits. We also, frankly, are likely to need more resources. So I anticipate a special session sometime in the next few weeks.
Just to follow up on that, on the resource thing, there was some reporting today that the president told governors he's not going to be there for ventilators. Look elsewhere. Maybe he's a backstop, but don't come to the feds for that kind of equipment. Were you on that call, and how does that change maybe how we're approaching things?
I was on that call, and we are continuing to coordinate and collaborate with the federal government in terms of services and supplies. As you know, we had a substantial request into the federal government. We received 1/10 of that request over the weekend in staggered drop-offs. And then my understanding is they're going to deliver another 15% of that request. So we have been told that supplies are forthcoming, and we expect to be receiving the amount that we need. I don't know, Director Allen, do you want to add anything to that?
No.
Okay.
Governor, the Gillian flag is with the Associated Press, and I actually wanted to clarify one thing from earlier.
Dr. Edwards?
Dr. Edwards, yes, thank you.
We'll let her come on up here then. Thank you.
Because I wondered, you had said statewide your projections, modeling shows there'll be need for 1,000 beds and 400 ICU beds. And I wanted to be clear, is that what we lack, or is that a total of what the need is? And if so, what do we lack?
That's the total of the need across the state just to take care of COVID-19 patients. The concern, of course, is that many of those beds are currently occupied by Oregonians who need health care for reasons other than COVID-19. So a significant concern is that this displaces some of the, at present, necessary ongoing health care. If it doesn't displace it, then we need those additional beds. All of our hospitals have taken actions at this time to limit what we call elective care or elective surgical procedures. As we all know, there are urgent medical conditions, conditions of trauma that will always occur on a daily basis. But there are other types of medical care that can safely be deferred for a period of time. And so all of our institutions are looking at what surgical procedures or what clinic visits make most sense to tell our patients, this can wait, we can hold off on this for a little bit, and therefore create capacity in our ambulatory clinics, in our surgical suites, and in our hospital to then be able to manage the volume of COVID-19 patients we expect to see.
How many hospital beds are there statewide? How many ICU beds are there statewide, and how many ventilators are there statewide?
I actually don't know the answer to that question specifically. I know the answer that we have at OHSU, and each of these other CMOs from their hospitals know their sites, but I don't know the exact numbers for the state. Pat may know those. Fabulous.
Yeah, Patrick Allen, Director of the Oregon Health Authority. We have somewhat over 6,000 licensed hospital beds of all kinds around the state. That's not a fixed number. There are hospital beds that exist in hospitals around the state that are not licensed, and so they're not included in that count. And there are a number of other variables that could cause that number to go up. There are also variables that could cause it to go down. Those beds would need to be staffed, and so staffing critical care beds is different than staffing other kinds of beds. And but that gives you a ballpark idea of what the supply is like.
And ventilators, do you have that?
I don't have that number handy.
Last question, there was a mention of standing up other places for beds, like pop-up hospitals, I guess, or can you elaborate on that? Can somebody say more about that? Sure.
Absolutely. Well, that is part of the effort that we were speaking to today, both at the emergency response plan as well as the task force that is being held up. We're looking across the continuum of care of our health system to identify our approaches, building off the regional commitments to how we can free up bed space, reduce the elective procedures being done right now, and figure out how we can organize and maintain our bed management at a regional and state level to support that.
Are there any plans currently to actually open new facilities, like in some other cities we've seen tents going up, or add-ons to hospitals?
Those are all planning underway right now. We know that we have the opportunity to do that, and we are actively deciding on the specifics of those at this time.
And Dr. Harganati, is there a goal for how many expanded beds above and beyond the current system that people are shooting for, maybe by April 11th or whatever the date was that was given, or later?
I don't have a number for you specifically, but the task force work is to really look at the epidemiology that Dr. Edwards has identified, that has been discussed, will be really a backbone to our planning efforts in terms of what we need to hold up.
No firm plans for a hospital expansion at this point?
We are looking at ways to have additional hospital level beds available for the potential for the surge coming, yes.
So you want to?
Yeah, please.
Part of the benefit of this all hazards command structure that Mr. Phelps talked about is the fact that it allows us to have them focus on and ask for capacity, and we are making that ask to them. We're looking for a variety of kinds of capacity, from ways that people who need care but don't need to use acute care hospital beds can have that care provided. People who need a place to recover but don't have that place, people who are homeless or in other circumstances where they could be at home but can't because they've not got access to that service. And so we are not thinking about getting access to beds. We are actively pursuing the creation of more bed capacity to ease that pressure.
My question is for Governor Brown for now with KTTV. Governor, you mentioned a crackdown on price gouging, but what about rations, toilet paper, and cleaning supplies? The problem doesn't seem to be really the high prices, but the lack of supplies out there.
So my understanding is that we have adequate supplies, and so I would encourage Oregonians to stop purchasing huge quantities of toilet paper, for example. And my understanding, at least in talking to the retail industry, is that we have the supplies we need. They have to obviously get out there every day. I want to encourage folks to only purchase what they need for a week or so at this point in time.
Not considering any measures right
Not at this point in time.
Governor Atwater's KCW, there are still some big organizations that are open, tribal casinos, daycares. Are you calling on them today to close?
So in terms of tribal casinos, obviously those are on our tribal lands, and those are sovereign nations, and I don't have the authority to close those casinos. I would ask that our tribal leadership of our 9 federally recognized tribes be working with their local health authorities and making the appropriate decisions to protect the health and safety of Oregonians. And your second question was daycare. We're working on a plan for childcare, at least for essential workers. That'll be released sometime in the next day or so. Again, we have to make sure that when we have parents who are doing essential public services like public safety or health care, that there are daycare sites available for their children to go and be safe.
Governor, question over here. Steve Freer, Chief Medical Officer for Providence in Oregon. One of the most pressing needs for all of our healthcare providers is personal protective equipment, the material we need to protect ourselves and to care of these patients. And as you know, this material is in short supply across the entire country. What tools does the governor's office have to either augment production locally or to repurpose industry in the state of Oregon towards producing more of this material?
That's a great question. I assume everyone heard that question. That's why it's critically important that our hospitals coordinate and collaborate around eliminating non-essential surgery. I have spoken with the Oregon Dental Association, and they are also focused on eliminating, let's see, I want to make sure I say this right, non-emergency procedures to preserve personal protective equipment. That includes masks, gowns, and gloves. And it's absolutely critical for our healthcare workers to have access to PPE because it preserves their safety and prevents the spread of the disease. But we also need it in other settings like congregate care or assisted living facilities. We're also working, our ECC is controlling that, and the work the 4 hospitals are doing, frankly, gives us a roadmap for the rest of the state. So, Director Allen, you want to add anything else?
Yes. Thank you, Governor. The supply of personal protective equipment is a critical problem that we're facing and the entire nation is facing right now. The system is dependent on our having a state stockpile, which we do and which we've been actively distributing from. But it's also critically dependent on federal stockpiles, both at the Department of Health and Human Services and now that there's been a federal emergency declaration through FEMA and through the military. And as the governor indicated early, we've made a significant ask and received about 10% of that and expect to receive another small component of that. We are pursuing creative kinds of ways of trying to come up with locally available or locally created PPE, but that's going to help at the margins. That's not going to help with the system overall. If there's not a significant change in the federal landscape on this, we will run out of PPE, and that's not just in Oregon, that's nationwide.
Director, I have a quick question for you. At least according to one data set that's been reported on in the last day, it looks like Oregon may have the fewest hospital beds per capita of any state in the country, 1.6. Interested in how maybe we got there. I mean, do you have any sense of why we would be the lowest in terms of hospital beds?
By doing a good job of providing access to primary care so that people don't require hospitalization and we're able to save costs in the healthcare system.
So that's a good thing that we don't have that many hospital beds?
You know, it's hard to generalize completely on an issue like that. And I did mention earlier that there are unlicensed beds that exist around the state, and that number isn't necessarily a fixed number. But yeah, we've been trying to shape the healthcare system to provide less acute care because we've done a better job of managing chronic conditions earlier.
Okay, but then in a situation like this, then maybe that becomes a difficulty. Is that right?
Well, I mean, it's hard to argue that we should keep people sicker so that we have the hospital beds, right? Can I just remind our speakers that we have several hundred people tuning in, including reporters and concerned citizens. So I'm getting feedback that people are having difficulty hearing the question. So if you don't mind, just please repeat the question before you answer it. Thank you.
I have a question for Dr. Harganani. Elizabeth Hayes with the Portland Business Journal. Can you talk about the coordination? Is there going to be a central triage? Is one system going to do this for all? How is that going to work?
Yeah, well, today, thank you. The question is, how are we going to do the coordination? Is there going to be a central place? Is it across hospitals? Just a question generally how that coordination will happen. So as we've talked about today, the regional hospital and our largest hospital health systems today are committed with partnership with the state and local government to do that coordination together, to look at where the needs are at a hospital level in particular and the needs of patient care. We're using that model and that collaboration to build on that with our task force that we're convening immediately that will help us look statewide and build on that. We're really using the crisis care guideline that I spoke to be a framework for lifting that organization and coordination across the state.
Gillian Franks with the Associated Press. What about rural hospitals? I mean, lots of Oregon is very rural, small hospitals. Do you feel that they're prepared?
We've been in contact with them. Oh, sorry. The question for everyone is what's happening with the coordination with rural hospitals and are they prepared? We've been working closely with the Hospital Association and hospitals across the state. We will be working with all of our partners across the state, including those hospitals and rural providers in this task force that we're lifting up now. Yes, I think everybody's preparing for this for a long time. People have used this guideline, and now we have a time to put that into place here. There was a question earlier that I just got information on. There was a question about the number of ventilators in our state, and the answer is 688. And that's part of this coordination that we're doing across our state right now.
Dave Dillon with Oregonian. I have a couple questions for Governor Brown. The first question is, if we're asking for 4 weeks of...
Oops. Sorry. Okay, I'll let you get it. Sorry, Corin and KATU. Thank you both. I'm sorry. Go ahead.
Sorry. Okay. So we're talking about 4 weeks of no public gatherings. Does that mean public schools will now be closed for 4 weeks?
We are evaluating our. Thank you. Sorry. Public gatherings over 25 are going to be canceled for the next 4 weeks. The question is, does that include schools as well? We're reevaluating our school policy. We will be announcing further decisions in the next couple of days. So at this point in time, we're still on the 2-week plus 2-day plan.
And then one more, if you could clarify what specific new task forces or plan activations began today?
I believe most of the actions from the Emergency Command Center to the Economic Recovery Advisory Task Force had been set up earlier. I'm not aware of anything other than the specific directives that happened exactly today.
Governor, I know in Washington, clubs, gyms were also extended as part of the restaurant. Is that part of your order as well?
Well, it's part of my request, right, for businesses to evaluate the services that they provide Oregonians. If they can't provide sort of a takeout option, to really examine whether they can continue to function as a business over the next few weeks.
One more clarification question is related to that. How does this impact malls?
That's a great question. My understanding is that we had a specific exemption for grocery stores and retail services. So, because in malls, you can comply with social distancing, for example, so 3 to 6 feet. That at least the malls I have been in, you can do that, and so my understanding is it would not apply. Obviously, there are food services in malls. We would ask that they comply and do the takeout version. You're talking about actual stores.
Yeah, thank you.
Great question. Thank you. 2 more questions?
I had a question for Dr. Edwards. I'd be interested in seeing the full set of data or modeling that you referenced, and I was not clear on, I missed who actually carried that analysis out?
Yes, the question is about the full analysis and where that analysis was developed. We're very fortunate at OHSU to have Dr. Peter Graven, who has been working on this modeling actually for several weeks as he's been watching what's happening around the world. And so he has done some forecasting, and he's also worked with the analysts at the OHA. And one of the commitments that we all made together with one another across the health systems was to contribute whatever analysts we had in our health system so that we could get all of these great minds together to have the most accurate forecasting and modeling as we move forward through this time. I anticipate that ultimately this model will be released. I cannot tell you right this second exactly when that will be.
What do you think would dictate? I know people would be interested, obviously.
Yeah, I think that I would like to talk to the folks at the OHA and also at OHSU and make sure that that's something that's ready to be released. I also want to make sure that we remember there are lots of questions, of course, about what resources we have, what hospital beds we have. Our goal is to prevent that surge. Our goal is to not have to get to talking about that place, but to employ the social distancing that Governor Brown has announced today to flatten that curve so that we don't actually have to see the rise and the potential peak that this model predicts. And I just really want to emphasize that point.
Just very quickly, we would expect to release that model. What we've been speaking from today are preliminary results of work that's really not quite complete yet, and that's what would cause us to need to take some time, is to actually finally finish the work and have some review of it.
Do you know how long that could take?
No.
Last question?
So I think part of what we're all grappling with is letting the public know what the concern is and what the danger is. And so it's not clear to me whether I should say, worst case, we're 1,000 beds short and 400 ICU beds short, but I kind of think that's what you're saying. Is that right? So maybe could you just clarify that?
The question is exactly what does the surge look like and what will the peak of the surge look like? And the modeling that we have to date is, again, through April 11th, because the actions we take now have a direct impact on the continued rise of cases in Oregon. And as of April 11th, the prediction is that we need 1,000 hospital beds in the state of Oregon, 400 ICU beds in the state of Oregon on April 11th, which you can imagine would suggest that we're heading into a period of time in the next week or two where we will see a significantly increase in the number of cases that are being reported. Again, the model talks about doubling the number of cases every 6.2 days.
Pat, and the question was in terms of bed capacity, and Pat and everyone, that's why I'm asking Oregonians to take these social distancing measures so personally and quickly, because the goal of the social distancing measures is to slow the transmission, and as you've been hearing time and time again, flatten the curve. That's why these social distancing measures are so important, for example, in rural Oregon as well. I think it's harder for folks living in rural Oregon, sometimes houses many miles apart, to say, why should we comply? Few cases of coronavirus in rural Oregon. But what we do know is that these social distancing measures slow the transmission and flatten the curve.
Just to clarify, Brenna with KPTV, if we abide by these social distancing measures, are we still looking at 1,400 short, or will that go down?
I'm going to let the experts answer that question.
The question is whether we abide by the social distancing measures. Will that help with the number that's predicted on April 11th? And we actually don't know yet, because we don't know, based upon Dr. Graven's model, if I'm saying this correctly, Mr. Allen, that we don't know yet if it's too late to have an impact leading up to April 11th, or if the changes that we make now will actually then impact after April 11th. But that's why we have to start right away. Yes,
All right.
sir. Oh, sorry.
Okay, one more.
Dave Kellogg, Oregonian. I was going to ask you
Sorry. I also would really love to acknowledge again that Dr. Graven and the analysts at OHA are really the experts on this. But
well, if this is a
please.
Are you concerned with the lack of the ability currently to test more people quickly, as that will lead to more cases of infection?
So the question is whether we're concerned about the lack of ability to test at present and whether that'll lead to more cases of infection. We're concerned about the lack of ability to test at present because at present we don't have any way to know who is actually carrying the COVID-19 virus and who is not, particularly among the patients, or the Oregonians, who are less symptomatic. Remember, 80% of people don't require hospitalization and can receive care at home. And so the difficulty is that for the people who are less symptomatic, without the ability to test and know whether or not they actually have COVID-19, you don't know who to isolate and who not to isolate. You don't know who's potentially infectious and who's not. So testing really helps us determine that on an epidemiologic standpoint.
Okay, thank you very much. Our speakers will be available after this conference. Thank you.